about a couple of just kind of reminders and then some planning for the future. I did want to introduce Julie Fowler, one of our newest education associates, and many of you may remember Julie as a superintendent in Abbeville or the deputy superintendent in our division when we were part of Standards and Learning. And some of you go far enough back as I do and remember Julie as a fellow special education director. So we're really glad to have Julie on staff with us. I'm also excited to announce that Nicole Adams is our new Assistant Director, Program Manager 1. So Nicole will be assuming some new duties and morphing into a slightly different role. And along the lines of morphing, we are creating and revising positions to ensure that we're able to provide support in the most effective way to districts. And as you all know, in many instances, we're talking about virtual support, a learning management system, or support through means such as this. We know the value of face-to-face interaction, but we also know the challenges with that now, and we want to make sure that we're getting information to you as quickly as possible, but also in as accessible a manner as possible so that you have it readily accessible to refer back to to go to use with new staff. And so we are kind of rewriting and expanding a couple of our positions on staff to really emphasize that virtual support as well. So I wish I could, I'm looking forward to the day when I can say that our priorities, that our first priority is not still health and safety, although I'm sure that will always be a priority. But in this day and age with the pandemic, health and safety have taken on a whole new meaning and a whole new level of priority. So as always, our priorities continue to be, as yours do, the health and safety of all first, students' needs, providing a free, appropriate public education through the delivery of services to as many students as you reasonably can in the safest and best way you can. And then communication, documenting your efforts in a focused, consistent, detailed manner to demonstrate your good faith efforts to provide FAPE. Quick reminder again, if everyone will mute their phones or laptops, computers, please. So as always, our priorities continue to be health and safety first. We have districts that are operating within our different methods of service provision. We have some districts that are still completely virtual because of the COVID rate in that community and area. We have others that are hybrid and virtual, still others that are offering all three service delivery models, face-to-face, hybrid, and virtual. And then I think we've got a couple of districts that are even right now face-to-face 5 days a week. As always, the goal is to reopen schools and provide parents that option of 5 days face-to-face as soon as we can do that safely. Everyone is making every effort possible to support the reopening of schools safely, again, for in-person learning. That is the goal, to be able to offer parents and students the option of 5 days a week in-person learning as soon as it is safe to do so for those parents who choose that option and for the students who need that option. So just a couple of reminders, and we heard this at the National Association of State Directors of Special Education from not only our OSEP contacts, but also a number of national speakers. Just the reminders to everybody that schools, the buildings were not closed and that did not necessitate a change in placement. So the closure of a school building was not a change in placement made by an IEP team. And the school closures were, everybody can mute, please. The school closures were a forced situation that was created by the global health and safety emergency that had IEP teams in schools dealing with this. So again, the school closures in the spring were not a change in placement that were made by the IEP team, and it wasn't anything that the IEP could do, the team could do to prevent that. It was not a decision made by the IEP team. Another reminder is that there is nothing in IDEA that mandates in-person instruction. What IDEA does mandate is the offer of a free, appropriate public education to all students with disabilities. And in that vein, an IEP has to be in place for each student with a disability. We are, as we've talked about before, we are shifting from what we had in the spring, which was access, back to learning and instruction, high quality, standards aligned learning and instruction. A couple of kind of reminders for folks and ways to look at what we're doing. And we've talked about kind of going back to basics and the fact that COVID has sort of forced us to relook at what we do, how we do it, and why we do it that way. And we'll talk about evaluation as a good example in just a moment. So the IEP is the documentation of the process of providing FAPE. That's the whole purpose of the IEP. The IEP is our documentation for the district's offer of FAPE to a student. IEPs do not start and stop. So we tend to think of school years as starting and stopping. They start typically in August, they stop end of May, early June. IEPs don't start and stop, and therefore they do not expire. If you have an IEP for which you were unable, even through alternative means, to conduct an annual review because of COVID, for example, that IEP has not expired. You are continuing to provide services to that student based on that IEP until you can meet and update the present levels and annual goals and services. IDEA requires that IEP be reviewed annually. So again, if we can stop thinking about an IEP as starting and stopping, but rather that documentation of the continuous process of FAPE, we realize that it may be that the team meets to begin the process of reviewing that IEP annually, but then needs to continue in another meeting. So if our previous date of annual review was June 1st, it may be that we meet on May 25th to start that review process. And sundry reasons are unable to conclude that process until after June 1st. And OSEP says that's all right. Although the process of reviewing the IEP annually has to begin on or before the one-year date, the conclusion, again, as long as it's for a defensible reason, may be after the date. But it's that review process. And again, let's say the IEP annual review is June 1st and you're not out of school until June 15th. You're not going to stop providing services to that child on June 1st because you weren't able to finish the annual review process. You'll continue providing services until that IEP is updated, revised, and changed if changes are needed. So again, the IEP is a document that that puts into place and spells out for everyone the process of the provision of FAPE. And it doesn't even though we talk about a beginning and ending date, what we're really talking about, not so much an ending date as when we are beginning the new types of services that are in that IEP, and where we will continue, knowing that for the most part, our schools exclude the summer months, although we do have some schools that are year-round. So just a reminder that the IEP is the documentation of the process of providing FAPE. And then things to think about. When we're looking at the way a student is being instructed now, maybe it's a change to a virtual instructional delivery model, we've got to go back and have the team ask, why did the student need specially designed instruction to begin with? What was it about the student's unique needs created by his or her disability? If I can get everybody to mute. I have a real hard time with the echoing and the feedback. Thank you. So why did the student need specially designed instruction to begin with? And if instruction or instructional delivery has changed now for some reason, we've moved to virtual, or something else about the instruction has changed, why does the student need specially designed instruction now? What is it about the student's disability that requires specially designed instruction in order for that student to access and progress in the general ed setting? There is no different standard for FAPE when a student is face-to-face or when a student is virtual. The standard for FAPE is the same, but what that looks like may change based on what kind of instruction and how the student needs to be supported in access to it. So if the gen ed instruction has changed, then the student's needs may have changed. Again, go back to ask why that student needs specially designed instruction to begin with, remembering that the whole purpose of the IEP is to document that provision of FAPE. So the IEP has to reflect the district's offer of FAPE. But FAPE can be written as in-person, hybrid, virtual. It can be provided through and should be provided through any of those models based on that student's unique needs and what the team determines are the result of that student's disabilities. Not all students with disabilities need in-person services in order to receive FAPE. We've got some students with disabilities that have been able to thrive in a virtual setting. We've got others that have really struggled. So FAPE is determined on an individual basis by the IEP team based on the data that have been collected on that student's unique needs resulting from the student's disability. So academic growth and safety of school community is paramount. OSEP lists, put out a Q&A related to service provision. I sent it out to everyone. The link is here and will be in the PowerPoint when we post it, but it was sent out on October 28th. And the United States Education Department emphasized again that academic growth and safety of school communities are paramount as we open schools again this fall. There are multiple options for instructional and service delivery. There are some places that have been offering these multiple options all along. There are others for whom some of these options are a different endeavor at this point. But again, regardless of the instructional service delivery model, FAPE, an offer of FAPE is required. I thought it was important to pull this reminder from that OSEP document and put it here. So OSEP reminds state education agencies and districts that no matter what the primary instructional delivery approach is that's chosen, whether it's hybrid, virtual, face-to-face, that SEAs, LEAs, and IEP teams remain responsible for ensuring that a free, appropriate public education is provided and offered to all students with disabilities. So as we open schools again this fall, regardless of the instructional method that's being used at this point or chosen by the parent or being used by the district, an offer of FAPE is required. As conditions continue to change throughout the country, some of the special education and related services that are in an IEP may need to be provided in a different manner. However, all children with disabilities must continue to receive FAPE and must have the chance to meet challenging objectives. And that, quote, the chance to meet challenging objectives, many of you will recognize comes directly from the Andrew case from 2017. It's that designed to provide meaningful benefit and the student has a chance to meet challenging objectives. So the alternate services and methods and delivery that the OSEP Q&A speaks to are virtual instruction, teleconferencing, direct instruction via telephone or video conferencing, or even consultative services to a parent if that's what's needed in order for the student to access and progress in the gen ed instruction, or a combination of some or all of these. Extended school year, the Q&A makes it clear that the U.S. Department of Ed recognizes that extended school year services are typically provided to students with disabilities during summer months. Not necessarily, because it could be any break in time, but typically we provide ESY in the summer. And the department understands that some ESY services, particularly those that require direct in-person contact, may not have been able to be delivered this past summer due to the pandemic. And in those instances, the district has to consider providing those ESY services to the child during the normal school year. It might be during the actual school year, during school breaks or vacations, or wherever would be appropriate to the child's needs. We've got to remember that ESY services prospective, meaning they are needed in order for the child to continue receiving FAPE. They are necessary during typically the summer for that child to continue receiving FAPE. They're not intended to make up for a past denial of FAPE. Those would be compensatory services. And again, they might need to be provided during the school year or school breaks if you were not able, because of health and safety reasons, to provide the services this summer. Michelle's going to talk just a minute about the ESY funds because we have had some questions along those lines.
Thank you, Becky. I just wanted everyone to know that ESY funds were distributed by our grants accounting department in late August. So you should see those. And if you don't see those, have your CFO check with the county to make sure that you are accessing those funds. And that's it. Thank you, Becky.
Thank you, Michelle. So let's talk just a minute about evaluations. The OSEP letter makes it clear, and I will tell you that the OSEP Q&A from September 28th didn't provide us a whole lot of new information or guidance. And you know, those of you who know me well know that when I say OSEP guidance, I'm putting air quotes around the word guidance. But it did reinforce health and safety first, student needs first, and the requirement for the provision of FAPE. But not really any new information. It did remind us when we're looking at how to complete evaluations, reevaluations, or just gathering progress monitoring data that we need to make decisions on, that teams should investigate all appropriate assessment measures and tools. You can work with the test developers to see if the instrument that you want to use could be administered remotely without impacting the validity and reliability. Unless you have that go-ahead from the test developer or the test manufacturer, you cannot change an assessment the way it's administered without running the risk of impacting the validity and reliability. So don't get caught thinking, well, we've always administered the blank when we assess blank. For example, we've always administered the WISC when we want to assess cognitive development. Instead, ask first, what area do we need information in? And then ask, how can we gather that information and why do we need it? So if rather than getting stuck in anytime we do an initial evaluation, we automatically give an IQ test, a measure of cognitive development, ask yourself why you need that. Do you need that because you're trying to rule out an intellectual disability? What purpose are you administering that standardized assessment? And is there some other way to get the information that you need rather than a standardized one-on-one in-person assessment? So again, this is kind of our opportunity to think outside the box and re-examine how we gather information, getting back to basics with what, sorry about that, with how do you gather the information and for what purpose do you need it? So the other thing that the U.S. Education Department, and that should be OCR instead of OCT, the Office for Civil Rights sent out on September 28th was a document, and again, it's linked here, that answered a lot of the same questions we've heard about students with disabilities with IEPs, but through a 504 lens. And again, it was reinforced that it is the USED's expectation that any phase-in plans that are designed and implemented by districts would provide the full benefit of educational opportunities for all students and meet the requirements of federal civil rights laws, which would encompass 504 ADA and IDEA. I'm going to stop at this point to see if there are any questions.
There are no questions.
Okay. Before I go to the next slide, I do want to say that we've got a little tiny bit more information about what OSEP's monitoring process, differentiated monitoring and support system will look like with us. We have set up monthly calls with our friends at OSEP and with our our technical assistance providers. We had our first monthly call earlier this week and got a little bit more information about the fiscal component. OSEP will be looking at our current website to try to determine what information they can from that and learn as much about us and what our processes look like from our website as they can. And then they will be asking for additional information or trying to get some of their questions answered in additional ways. But they are sending us the protocol that is aligned with the fiscal requirements. And we feel like we're in really good shape with that because the last several years we have used that tiered system with fiscal on a risk basis where your district completes the self-assessment or the assurances. Based on those results, districts that are at risk then go through a Tier 2 desk audit. Based on those results, districts that where there are identified issues then go into that Tier 3 more intensive monitoring that typically has been done on site and face-to-face, but we did complete the last several parts of that process with districts virtually last year. Our focus will be on assisting districts in correcting any findings of noncompliance and in putting systems into place and building district infrastructure so that you can show continued improvement. And that's kind of a good lead into what we're going to talk about pretty much lastly. And I'm going to turn things over to Nicole at this point.
Yes, Lisa was just asking in the chat when that stuff would be coming out, and I said, hold that thought. It's coming, it's coming, it's coming. So the last time we met, we talked about the SOTA, and we had some deadlines that only related to those districts that are in tier 2 or 3. If you are a universal district, remember there were no deadlines or specific requirements. We would definitely encourage you to use that root cause analysis or that action plan. They're great tools, but definitely not required. The other piece of that, Becky has talked a whole lot about health and safety and prioritization. And in that vein, we are adjusting our work with tier 2 and tier 3 just a little bit for this year. So what we discussed last time, you all have gotten emails. If you are in tier 2 or tier 3, you have received an email from me today. So the way that's going to look, because the intention is to fix issues that are very likely systemic, we are going to incentivize anybody who wants in tier 2 or 3 who wants to start working on that root cause analysis or develop an action plan for this year, but we are not going to require them to do so this year. Like I said, in that vein of prioritizations, because we did, as we spoke with many different districts about entirely different things in the SOTA, we have found everybody is in a completely different place. Even if you are a universal support district and normally very strong, there are some folks that just have so many balls in the air that one more thing might be the death, might be the death of them. So we are adjusting what we are doing with districts in tier 2 and tier 3. So if you received that email from me, we are going to incentivize going through that root cause analysis. We are also working with both TASC and BASC at this time. If your data shows that you are struggling in either post-secondary outcomes or social emotional learning, they are also going to be reaching out to those districts. That got one of my emails, but this year it is definitely where are you at, and let us help you if you are in a place where you can accept that help, because it's not going to do us any good to make you go through the steps of something that, if they're not going to be meaningful, it's kind of like that Maslow's hierarchy of needs. If you are just focused on survival, and many folks are, if you were just focused on survival, we're not going to be able to teach or grow. This isn't the time for that. So we are adjusting it. Like I said, if you got that email, we would love to work with you. We would love to incentivize, give you some incentives to start that this year, because, like I said, we're working on systemic issues. It's very likely that you'll be in tier 2 or tier 3 next year, especially since we have no assessment results from last year or ready to work results from last year. So those ratings aren't going to be able to change because there isn't a way to change them. So we definitely, if you received one of those tier 2 or tier 3 emails from me and you would like some additional incentives to start this, and you're in a place where you can, I hate the font on there. It would not let me change the color of that, but that is my email. But my email is also in all of those letters, and you can just reply to it. And we can start by kind of looking at your data and where you need support and what incentives might apply based on your data. The other piece of that I wanted to let everybody know about is the data. We are definitely going to be modeling effective use of data and trying to ensure that we are continually using data with all of you. So I want everybody to know, before fall admin, you will be getting a specific email. I believe it will come from Carolyn. It'll either come from Carolyn or myself. And it's going to give you a summary of all of your data for the last 3 years on all 7 of those performance factors. So on all of those performance factors, you'll know exactly where you stand, and it will also tell you, here's the state average, not the target, but the state average, because everybody likes to be able to compare where do I stand relative to my peers. So as you get that data, when you see negative numbers, that is a place that you are going to want to work. The reason we're giving it to you before fall admin is at fall admin, you're going to have 4 breakout sessions with our 4 groups, and they're going to be rolling out some universal supports. And they're going to be talking about, if I were a director, here's how I would use this, or this is how you can use this. This is where you find this. This is where you go for this. But if you have that data immediately in front of you of where you need work, they can also help you with, hey, if your graduation rate is an issue, here are some of our universal supports in that area. So you can look physically at your data in the moment and go, I need to tune in right now. This is where this is going to be important for me. So that's kind of, we want you all to see how all of those things are going to begin tying together. Does anybody have any questions? And if you just have questions that you would simply prefer to not ask in the group, again, I am definitely very accessible in email. Email's usually the very best way to reach me, the very fastest way to reach me. These days, I spend a lot of time in webinars and virtual meetings. So definitely, we can also set up time if you wanted to talk about it. I have had a couple of districts reach out who were not in tier 2 or tier 3, just to say, hey, I'm dying. I need to know if I'm in tier 2 or tier 3. Help me out. And we walked through their data, and I provided them some very specific examples of, this is where you're above, this is where you're below. You might want to think about immediately working on these areas, and these areas, you know, you're better than the state average. You might be okay there. So by all means, we absolutely love our data and want to be good stewards of data and ensure that we're helping you all use it in every way possible every time that we can. So we'll be doing that for fall admin. And like I said, if you are one of those tier 2 or tier 3 districts that I reached out to this morning, this late morning, we would love to hear from you. We are very excited about our new process and think it will be very helpful. But again, you've got to be in a place where it's going to be helpful. And so we want to be sure that we're helping and that you're in a place where you can learn about it. So with that, if there are no questions, I don't see any in the chat, I'm going to hand it back to Becky.
Thanks, Nicole. And we do want to be responsive to district needs. And as supportive in this situation as we can. You will be getting, you know, we've already put and have assured you that as far as indicators 11 and 12, we will be working with you. We, as the state, will take the hit for issues that were related to COVID with not being able to complete those, as long as you've got your documentation that you made good faith efforts and explored other options. We will continue to be responsive to your needs, working with SCASA, and had a great suggestion by Angie Slatton to arrange some of the times with SCASA with our special ed leaders roundtable meetings to allow you to talk with each other and work with each other and learn from each other and structure what we're doing around our areas of outcome, around specific indicators. So we're working on that. And we want you to be able to find support with each other. We want to be able to, so that you don't have to do so much of the legwork to figure out, well, who's a district that's very similar to mine demographically that is doing a good job with, or at least is moving in the right direction with ABC. We want to be able to provide you with those data, as Nicole says, so that you can reach out. Our work with pulling cohorts together is going to support being able to provide technical assistance and professional development to around common themes and around common issues. And we're really excited as we move forward with our process, again, that it aligns with the process it appears that OSEP is using with their new differentiated monitoring and support system as well. I don't see any questions in the chat box. Please always continue to reach out to us with questions. As Nicole said, email is the best way to reach us at this point. If you've got questions, specific concerns, or specific situations you just want to talk through with someone, we're always available. The recording I got so excited because usually Aisha has to prompt me to remember to send her the PowerPoint after our calls. Today I got so excited because I sent the PowerPoint to her before we started the call, and then I found the issue I needed to correct with October versus OCR. So I will send the corrected PowerPoint to Aisha, and we will get this one posted as quickly as possible. I hope everyone has a great rest of the week, and I hope everyone is taking care. Thank you.